Hello and welcome. Today we're going to talk about something incredibly important but often overlooked, our kidneys. These two small bean-shaped organs tucked away just below your rib cage are true powerhouses. They work tirelessly day and night to keep your body in balance. Many of us don't give them a second thought until something goes wrong, and that's precisely why we need to have this conversation. Kidney disease can be a silent condition, creeping up without obvious signs until it's quite advanced. But the good news is that with a bit of knowledge, you can take powerful steps to protect them for years to come. In this journey together, we'll unravel the mysteries of kidney disease. We'll explore what it is, why it's more common than you might think, and how it can affect your entire body, even your brain. We will look at the main culprits behind kidney damage, from common conditions like diabetes and high blood pressure to lifestyle choices you might be making every day. It's not all doom and gloom, I promise. Understanding the causes is the first step towards prevention and better management. We'll also delve into some fascinating differences in how kidney disease can present in men and women, which is a topic not often discussed. Furthermore, we'll roll up our sleeves and get practical. One of the most effective tools you have in your arsenal is what you put on your plate. I will share some simple, clear dietary advice. We'll identify 5 specific types of food that can be troublesome for struggling kidneys, and, more importantly, I'll give you some delicious and easy swaps. You don't have to feel deprived to eat for kidney health. It's all about making smart, informed choices that can make a huge difference to your overall well-being and take some of the strain off these vital organs. My goal here is to empower you with information. This isn't about scaring you, it's about equipping you. By the end of our discussion, you'll have a much clearer picture of what your kidneys do and how you can be their best friend. We'll finish with some actionable tips to help you protect them, encouraging a proactive approach to your health. Remember, looking after your kidneys is a team effort between you and your healthcare provider. Let's get started on understanding and supporting these remarkable little organs. So let's start with the basics. What are your kidneys actually doing all day? Think of them as your body's highly sophisticated filtration system. Every single day, your kidneys filter about 180 liters of blood. That's an astonishing amount. As the blood passes through them, they pull out waste products, toxins, and excess fluid, which are then turned into urine and flushed out of your body. This process is absolutely vital. Without it, these harmful substances would build up in your bloodstream, making you very ill. But that's not all they do. They are multi-talented little organs. Healthy kidneys also play a crucial role in managing other bodily functions. They help to control your blood pressure by regulating your body's salt and water levels. They produce a hormone called erythropoietin, which tells your bone marrow to make red blood cells. These are the cells that carry oxygen all around your body, giving you energy. Your kidneys also help to keep your bones strong and healthy by activating vitamin D, which is essential for calcium absorption. They truly are jacks of all trades, working quietly in the background to maintain a delicate and healthy balance within your system. Now, what happens when things go wrong? Chronic kidney disease, or CKD, occurs when your kidneys are damaged and can't filter blood as well as they should. This damage doesn't happen overnight. It's usually a gradual process that unfolds over many months or even years. As the damage progresses, the kidneys become less and less efficient. This means waste products and excess fluid start to accumulate in your body instead of being removed. Imagine a very fine sieve that slowly gets clogged up over time. It just can't do its job properly anymore. The real challenge with kidney disease is that you might not feel anything is wrong in the early stages. Your kidneys have a remarkable amount of reserve capacity, so they can cope with a fair bit of damage before symptoms become noticeable. This is why it's often called a silent disease. By the time you start to feel unwell, a significant amount of kidney function may already have been lost. That's why awareness and early detection are so incredibly important. Knowing the risks and getting checked, especially if you have conditions like diabetes, is key. You might be surprised to learn just how widespread kidney disease is. It's not a rare condition that affects only a few people. It's a major global health issue. In fact, It's estimated that around 1 in 10 people worldwide have some form of chronic kidney disease. That's a staggering number, amounting to more than 800 million individuals. The problem is that the vast majority of these people don't even know they have it, because the early stages are often symptom-free. Many go undiagnosed until the disease has progressed to a more serious point, where treatment becomes more complex. The numbers are quite stark when you look at them closely. In the UK, for instance, it's thought that around 3 million people are living with CKD. However, experts believe the true figure could be much higher, as many cases remain hidden. The lack of early symptoms is the primary reason for this gap. You can lose up to 90% of your kidney function before you experience severe symptoms like nausea, fatigue, or swelling in your legs. This silent nature makes it a public health challenge, as opportunities for early intervention are often missed, leading to poorer outcomes for patients. This lack of awareness is a significant hurdle. Think about it, we are regularly encouraged to check our blood pressure and cholesterol levels, but how often do we hear about getting our kidney function checked? Unless you have a known risk factor, such as diabetes or a family history of kidney problems, it's probably not on your radar. This needs to change. Simple blood and urine tests can detect the early signs of kidney damage. Making these tests a routine part of health checkups, especially for those at higher risk, could make a monumental difference in catching the disease early. The rising prevalence of kidney disease is closely linked to the increase in other chronic conditions. The global epidemics of type 2 diabetes and high blood pressure are the two biggest drivers of CKD. As more people develop these conditions, the number of people with kidney complications also rises. This creates a domino effect on our healthcare systems. Treating advanced kidney disease is incredibly expensive, often requiring dialysis or a kidney transplant. By focusing on prevention and early detection, we can not only save lives, but also reduce the enormous burden on health resources. When your kidneys start to fail, the effects aren't just confined to those two small organs. The consequences ripple throughout your entire body, affecting your health and quality of life in numerous ways. One of the first things to be affected is your energy level. As the kidneys struggle, they produce less of the hormone erythropoietin, leading to a shortage of red blood cells, a condition called anemia. This means less oxygen is delivered to your muscles and brain, leaving you feeling constantly tired and weak. It's not just normal tiredness, it's a profound exhaustion that a good night's sleep can't fix. The buildup of waste products, known as uremia, can also wreak havoc on your system. Think of it as a slow poisoning. This accumulation of toxins can make you feel sick to your stomach, lose your appetite, and even change the way food tastes. Many people with advanced kidney disease report a metallic taste in their mouth. This can lead to poor nutrition and weight loss, further weakening the body. You might also experience swelling known as edema in your ankles, feet or hands. This happens because your kidneys can no longer get rid of excess salt and fluid effectively. Your brain is not immune to these effects either. The buildup of toxins can lead to what is sometimes called uremic encephalopathy, or more simply, brain fog. This can make it difficult to concentrate, cause memory problems, and even lead to confusion or changes in personality. It can affect your ability to work, to socialize, and to simply think clearly. Many people describe it as feeling like their head is full of cotton wool. It's a frustrating and distressing symptom that highlights just how connected our kidneys are to our cognitive health and overall mental well-being. Beyond these symptoms, kidney disease significantly increases your risk of heart disease. In fact, people with CKD are far more likely to die from a heart attack or stroke than from kidney failure itself. The conditions are closely linked. Poor kidney function can lead to high blood pressure, and the buildup of waste products can damage blood vessels in the heart. Your bones can also become brittle as the kidneys lose their ability to activate vitamin D and balance calcium and phosphate levels. From your brain to your bones, the health of your kidneys truly matters for your whole body. So, what puts our kidneys at risk? There are several key culprits, but two conditions stand head and shoulders above the rest: diabetes and high blood pressure. Together, they are responsible for about 2/3 of all chronic kidney disease cases. In diabetes, high blood sugar levels can damage the tiny blood vessels in your kidneys that act as filters. Over time, this damage prevents the kidneys from cleaning your blood properly. It's a slow, gradual process, which is why regular kidney health checks are so vital for anyone with diabetes. Keeping blood sugar levels under control is the best defense. High blood pressure or hypertension is the other major cause. Think of your blood vessels as a system of pipes. If the pressure inside those pipes is consistently too high, it puts a strain on them, including the delicate vessels within the kidneys. This constant pressure can damage and weaken them over many years, reducing their ability to function. Just like with diabetes, the damage from high blood pressure is often silent until it's quite advanced. That's why managing your blood pressure through lifestyle changes and, if necessary, medication is absolutely crucial for protecting your kidneys. Beyond these two main drivers, there are other specific diseases that can directly attack the kidneys. Conditions like glomerulonephritis, which involves inflammation of the kidney's filtering units, and polycystic kidney disease, an inherited disorder where cysts grow in the kidneys, can lead to kidney failure. Recurrent urinary tract infections that travel up to the kidneys can also cause damage over time. It's important to remember that sometimes the cause is directly related to the kidneys themselves, rather than being a complication of another illness. Finally, we have to consider lifestyle factors and medications. The long-term, regular use of certain over-the-counter painkillers, particularly non-steroidal anti-inflammatory drugs like ibuprofen, can harm the kidneys, especially in those who already have reduced kidney function. Lifestyle choices also play a part. Being overweight, smoking, and having a diet high in salt and processed foods can all contribute to high blood pressure and diabetes, thereby indirectly increasing your risk of kidney disease. Making healthier choices in these areas can go a long way in safeguarding your kidney health. It's interesting to note that kidney disease doesn't affect men and women in exactly the same way. While the underlying causes are often similar, there are some distinct differences in risk, progression, and experience. Generally, chronic kidney disease is slightly more common in women than in men. However, men are more likely to progress to end-stage kidney disease, the point where dialysis or a transplant becomes necessary. Scientists are still exploring all the reasons for this, but it seems to be a complex mix of hormonal, anatomical, and lifestyle factors. For women, certain health issues unique to them can increase the risk of kidney problems. For example, pregnancy can put a significant strain on the kidneys. Conditions like preeclampsia, which involves high blood pressure during pregnancy, can cause acute kidney injury and may increase the risk of developing chronic kidney disease later in life. Autoimmune diseases such as lupus are also far more common in women, and these conditions can often attack the kidneys, leading to a specific type of kidney inflammation called lupus nephritis. Urinary tract infections are also more common in women, and if they become chronic or severe, they can sometimes lead to kidney damage. For men, lifestyle factors and other health conditions often play a larger role in the progression of their kidney disease. Men tend to have higher rates of cardiovascular disease, which is closely intertwined with kidney health. Lifestyle choices that are historically more prevalent in men, such as higher rates of smoking and alcohol consumption, can also contribute to faster kidney function decline. Furthermore, an enlarged prostate, a common condition in older men, can obstruct the flow of urine, causing pressure to build up and potentially damage the kidneys over time if left untreated. These gender-based differences highlight why a personalized approach to healthcare is so important. A woman's health history, including her pregnancies and any autoimmune conditions, needs to be considered when assessing her kidney risk. For a man, a strong focus on cardiovascular health and lifestyle modification might be the most critical intervention. Understanding these nuances helps doctors provide better, more targeted care. It's not about saying one gender has it worse than the other, it's about recognizing that the journey with kidney disease can look different, and care should reflect that reality. When your kidneys are struggling, adjusting your diet is one of the most powerful things you can do to help. The goal is to reduce the amount of waste and fluid your kidneys have to handle. Let's look at 5 types of food to limit or avoid. First on the list is sodium, which is found in high amounts in salt and processed foods. When your kidneys aren't working well, they can't remove excess sodium efficiently. This causes fluid to build up in your body, leading to swelling and high blood pressure. A simple swap is to cook from scratch using herbs and spices for flavor instead of salt. Avoid processed meats, canned soups, and ready meals. Next up is potassium. Healthy kidneys keep potassium levels in check, but damaged kidneys can't. High potassium levels in the blood can be very dangerous, potentially causing serious heart problems. Foods that are very high in potassium include bananas, oranges, potatoes, tomatoes, and avocados. While these are healthy foods for most people, they might need to be limited if you have chronic kidney disease. Good low potassium swaps include apples, berries, cauliflower, and cabbage. It's about being mindful of portion sizes and choosing your fruits and vegetables carefully, not eliminating them entirely. Phosphorus is another mineral to watch. Just like with sodium and potassium, damaged kidneys struggle to filter out excess phosphorus. When phosphorus builds up in your blood, it can pull calcium from your bones, making them weak and brittle. It can also cause itchy skin and dangerous calcium deposits in your blood vessels, heart, and lungs. High phosphorus foods include dairy products like milk and cheese, red meat, and dark-colored colas, which contain phosphorus additives. Instead, you could try rice milk, eat smaller portions of lean poultry, and switch from cola to water or clear sodas. Protein is a bit more complex. Your body needs protein to build muscle and repair tissue, but when your body uses protein, it creates a waste product called urea. With kidney disease, urea can build up in the blood and make you feel sick. You don't want to cut out protein completely, but you may need to control your portion sizes. Eating high-quality but smaller portions of protein from sources like chicken, fish, and eggs is often recommended. Your dietitian can help you find the right balance. Finally, be wary of sugary drinks and snacks. They contribute to high blood sugar and weight gain, which are major risk factors for kidney disease progression. Water is always the best choice for hydration. We've covered a lot of ground, from understanding how our amazing kidneys work to the practical steps we can take in our kitchens. The key takeaway message is one of empowerment and proactivity. Protecting your kidneys is not about a drastic overnight transformation, but about making a series of small, sustainable changes that add up over time. The most important action you can take is to manage the major risk factors. If you have diabetes or high blood pressure, work closely with your doctor to keep your blood sugar and blood pressure levels within your target range. This is the single most effective way to prevent kidney damage. Regular checkups are your best friend in the fight against kidney disease. Don't be shy about asking your doctor for a kidney health check, especially if you fall into a high-risk group. A simple urine test for protein called albumin and a blood test to estimate your glomerular filtration rate, or GFR, can tell you how well your kidneys are working. Catching any problems early gives you the best possible chance to slow down or even stop the progression of the disease. Think of it like a regular service for your car. It's essential maintenance to keep the engine running smoothly for years to come. Embracing a kidney-friendly lifestyle is something everyone can benefit from, regardless of their current kidney health. Aim for a balanced diet that is low in processed foods, salt, and sugar. Drink plenty of water to stay hydrated. If you smoke, quitting is one of the best things you can do for your kidneys and your overall health. Regular physical activity, like a brisk 30-minute walk most days of the week, can help manage your weight, blood pressure, and blood sugar levels. These are not complicated rules. They are simple, powerful pillars of good health. Finally, remember that you are not alone on this journey. If you're diagnosed with kidney disease, it can feel overwhelming, but there is a wealth of support available. Your healthcare team, including your doctor, nurses, and a dietitian, will be your partners in care. They can provide you with the guidance, treatment, and encouragement you need to manage your condition effectively. By staying informed, asking questions, and taking an active role in your health, you can protect your precious kidneys and continue to live a full and vibrant life. Your health is in your hands.